Well, I'm Nicolas Mottet. I'm the chair of the Prostate Cancer Panel Guidelines at EAU. I would say a huge question mark. What is it? Is it real? Is it, and even worse, is it reliable? And I think it needs to be proven that it's reliable. But there's also some expectations because we have all what we are doing is based on randomized trials where patients are, I would say, artificially selected, super selected, far away from what we see in everyday practice. And so this kind of real-life data might confirm, modify, or improve what we believe based on randomized trials, might also answer questions that are not answered on randomized trials. Well, to be provocative, I would say almost every step and every situation is under-researched. Again, what we do is mostly based on two things: randomized controlled trials, and as I said, we have major issues with this because they're not representative of real-life data, and on personal experience, which is always biased. So what we're trying to do in guidelines, for example, is to do systematic reviews, and based on that we make recommendations for doing something. But the systematic review is only based on what is published, and we all know that what is published is not exactly what happens in real life. For example, only very large centers publish their data, while many patients are treated outside expert centers. So that's it. Almost every step is under-evaluated or partially evaluated, so there might be answer for almost every situation. So I will not highlight one or another one because it's the entire journey of prostate. I do believe that if we want to improve what we're doing, we need facts. The only way to get facts is to share data. It's not a way that the first step. It's not a way to know that if you are better or worse compared to other doctors or other teams. If you have 10 cases, it's useless. If you have 1,000 cases, it might become to be useful. That's the first step. So if we want to know exactly what's the best for our patients, there's no other way than to share data. The second thing is, it's about self-evaluation. You believe as a team that you're doing a good job, and suddenly you realize that your outcome is not as good as expected compared to peers. If you're clever, you will think a little bit, well, why did I've done something wrong? Where in the journey? And it might also be a way to improve what you're doing as a clinician or as a team to improve the patient's outcome, which is our ultimate goal.